to the August 19th Public Health COVID media briefing. You're going to hear from a couple staff members on updates regarding cases, hospitalizations, vaccines, and some testing. And then, as always, we will open it up for questions from the media. Please raise your hand and wait for me to call on you prior to asking your question. With that, I'm going to hand it over to Dr. K.
Good morning, everyone. Thank you for joining us. So with the numbers, and these are numbers from yesterday, we have 124,985 cases of COVID-19 reported to Sacramento County and 1,834 deaths. We are still averaging about 500 new cases per day, and our case rate is at 30.9 per 100,000. There does seem to be a slowing down in the rate of the cases being reported, but we're still monitoring very closely to see if this is actually a peak or it's just a slowing down, but that the surge will continue going up. With hospitalizations, the last report is we have 428 people in the hospitals in Sacramento County that have a COVID diagnosis, and 100 of those are in the intensive care unit. When you compare with previous surges, we have surpassed the numbers for the summer surge of July 2020. And we are on track to either reach or even exceed the numbers for the winter surge. So we still have some concerns, especially about the impact on our hospitals, and continue to remind people that we do need to reserve the emergency services, both 911, ambulance, and the emergency rooms for emergencies only. With that, I will turn it over to Rachel to talk about the booster doses or third dose.
Sorry about that, technical difficulties. Yeah, so I'll go ahead and answer questions about the third doses and then the additional information that we were given about that's just come out about boosters. So the CDC Advisory Committee is recommending a third dose, and it's been approved by the FDA as well, for individuals who are moderately or severely immunocompromised. And this is intended to improve their immune response in this very specific population so that they can mount a more robust response and immunity. It's a specific list of conditions, and you can find it on the CDC website. It's very detailed. These doses must be administered 28 days after the second dose of mRNA vaccine, and it is just for the mRNA vaccine, so Pfizer and Moderna. And then the Western states, of course, have their own scientific safety review group as well. They've endorsed this recommendation and also emphasize that a person's medical care team is really best positioned to make the decision as to whether someone needs this vaccine. And so we really are encouraging people to reach out to their medical providers to see if they qualify for this dose, and then to make an appointment to get the vaccine. Pharmacies are also could be a second choice, I think, but if you have a personal provider, that's where we would want people to reach out to. And just a reminder, it's good if people will bring their CDC card with them, so that we can make sure that that third dose gets onto the card, and also verify that they have had the first two doses, that they were in the correct timing. And then it's also important to note that the CDC is not recommending additional doses or boosters right now for any other population. So right now, this is just for those who are moderately to severely immunocompromised. But yesterday, of course, we had additional news that booster shots are likely to be recommended for all Americans mid to late September. Again, the thought is this is going to be for Pfizer and Moderna, but probably some kind of recommendation coming as well for Johnson & Johnson. This doesn't have FDA or CDC approval just yet, so we're going to wait and see how that develops. But we also acknowledge this is a huge undertaking for our health systems, for the providers that we work so closely with, pharmacies, small providers. And so we are beginning to make early plans, knowing that this is coming And we'll continue to plan with them. We meet with them weekly anyway, so we'll continue to put these plans into place. But we are urging people that this is not happening just yet. So right now, the third dose is for people with the immunocompromised conditions. And while these third doses and boosters, we acknowledge that they're important, we still have a significant number of Sacramento County residents who've never gotten a first dose. And that's what we really want to emphasize, is that we still need to get to herd immunity, getting people both first and second doses. This is still our highest priority. And we don't have the numbers for you right at this moment, but I think Dr. Kay said hospitalizations are up. We're seeing it in younger people. And so just can't emphasize enough and just urge the community, please do not delay getting vaccinated. Please reach out to your provider or go to a community clinic to get that dose. And so with that, I'm going to turn it over to Megan Sheffield, and she can share with you all the places people can go to get vaccinated.
Thank you. So if you or anyone you know is looking for a COVID-19 vaccination clinic, you can find the community pop-up sites listed on our Sacramento County Vaccine Registration website. Sacramento County Public Health typically posts 20 to 25 local clinics per week located throughout the county. It also has a list of pharmacies and other locations that you can go to receive vaccine appointments. We ask that people check the website regularly due to whether some clinics may change or move to other locations. Clinics may also be added to the website as resources become available. In addition, you can find vaccine appointments on myturn.ca.gov, and walk-ins are accepted at most clinics.
That concludes the update. We will now open it up for questions. Please raise your hand and I will call on you. Michael, go ahead.
Hi, this is Mike from the SAC-B. So the hospitalizations seem to be increasing pretty quickly. By my math, they're about 80% of where they were from the winter surge, but the case rate is only about half of where it was at that time or during that surge. So I was wondering if you could shed any light on what, is that because of the Delta variant? Is there any particular reason why hospitalizations are increasing so fast? And secondly, are there any, what specific actions can the county take to assist or relieve if those hospitals do start to get into a state of overwhelm?
So we do agree with your observations, is that when you look at the hospitalizations, they're much closer to the numbers during the winter peak than if you are looking at just the cases. I don't have a clear explanation as to why that is happening. Definitely, we know it's due to the Delta. All of the cases that are sent for sequencing are showing the Delta variant. The other thing also to note is that both with the cases and with the hospitalizations, the majority, 80 to 90%, are still people that are not vaccinated. They tend to get more severe disease. And now we actually on our dashboard do have a graphic that shows the comparison of case rates for those that are vaccinated compared to those that are not vaccinated. So I encourage you to look at that. In terms of what we are doing with the hospitals, we definitely continue to monitor and have check-ins with them on a weekly basis. We also are providing that information to the state, and if there are requests for assistance, such as for additional staffing, we're able to coordinate that and send that over to the state to request the additional staffing.
Monica, go ahead.
My question has to do with California being one of the first states to require vaccinations for large indoor events. Will the county provide venue owners with the resources to do testing for those who don't want to show a vaccination status or aren't vaccinated? And also, will the county help provide support when it comes to people who don't want to comply and may be defiant to this new order?
The event coordinators have actually been discussing this for quite a while, and many of them already do have systems in place to be able to do the testing. Many of them are using the antigen test where you can get results in 15 to 20 minutes, and they are using their own resources. We are providing assistance by way of guidance, or if they have questions, being able to answer those questions. But otherwise, they are making the arrangements themselves to be able to get this done. And for many of the events, they also do take care of their own security for people that choose not to comply.
And also talk to me about the start date. I know it's September 20th, and then we're going to reevaluate if we need to continue to do this November 1st. Why that start date and why that end date?
The start date was selected to allow for the event organizers to make the arrangements and set this in place. As I mentioned, some have already been discussing this, have already made the arrangements, so they're going to probably be able to start sooner. As far as the end date, that's an estimation of when the state expects that we'll have more information about where this current surge is going. From the projections, they are estimating that we still have about a month or two into this surge. So by November, we should know better and evaluate at that point whether it needs to be continued or not.
But like you said earlier, when it comes to hospitalizations, we're on track to beat our numbers from last year. Is that a concern, or are we kind of waiting to get numbers across the state before we can implement this long term?
The hospitalizations, yes, we are concerned about them. And as I mentioned, we continue to work with the hospitals administration to make sure that they have the resources that they need, or if there needs to be changes made in terms of where patients are being sent, that we're able to do that. And of course, we are coordinating with the state. And I guess if I'm getting you correctly, what you're asking is what the coordination is with the event testing. Are we relating that to the hospital surge?
Right, because if November 1st, we're going to evaluate whether or not we're going to continue requiring vaccination status, when we already know that we are on track to beat our hospitalization numbers last year, why don't we just go ahead and not have that November 1st date? Does that make sense?
Well, November 1st is not, it's not an end date. It's just a point for us to be able to reevaluate.
Okay. And then I do have to ask, September 14th is the recall. September 20th, we implement this. Does that date have anything to do with the governor trying to wait until after voters have had their chance to speak their minds before implementing this vaccination requirement at large events?
Monica, that's a question you need to ask to the state. That's not a local health officer question. Thank you. Alex, go ahead.
Hi, Alex from the SACB. I've got a couple questions. First, I'll start off. I know we talked about a couple weeks ago growing interest in COVID testing and seeing longer lines there. I apologize, I missed the first part of the meeting, but can we get an overview on what testing looks like in the county? Have we seen, expanded hours or more tests given out, that kind of thing?
We are seeing an increase in demand, and we are in the middle of making arrangements to increase the resources that we have, and also reviewing the staffing as well as the dates and times that we have for the community testing sites. I don't know if Carlos, you have any additional points that you'd like to add to that?
No, I think that's essentially what we're seeing is increases, of course, in the demand, and then looking at expanding. We have certainly expanded hours. We've added staff. We're making sure that we have ample supplies for our community test sites. You asked for a bit of a summary of what we have currently. We have 13 community test sites. We are kind of always assessing, where would we have the most bang for our buck to add potentially some additional testing sites. But I think right now, the most immediate strategy for benefit is expanding our current infrastructure, which we're doing.
Can I just ask a follow-up related to this, which is, have you gotten a sense of why we're seeing a large increase in testing interest? Is it because of children going back to schools or more indoor activities requiring a vaccine, or excuse me, negative test results? Just what are you hearing on the ground there?
It's multiple factors. It is partly related to children going back to school. It's also related to the fact that we are seeing more cases in the community and therefore more people getting exposed and therefore wanting to get tested. And also there are the new health orders that were issued requiring testing for certain sectors such as healthcare. So that is all adding to the increased demand.
Mike, go ahead.
I have one follow-up question to my previous question and then one last question. First, following up, you said that you have weekly check-ins with the hospitals and that they could potentially see requests to the state for additional staffing. Has that happened yet in the winter surge or during this Delta surge? And my second question is, are we getting any sense of where the cases are coming from in terms of, are these workplace outbreaks? Are they related to schools opening? Just the contact tracing side of it, I guess.
Yes, we do have a coordinator that receives the requests for staffing. And yes, we did get some requests during the winter surge, and we have received a few during this surge as well. And your question about what was, could you repeat the second one, please?
Just if we have any more info or trends that we're seeing in terms of, are more cases coming from, workplace outbreaks or schools or from households? Where are we seeing cases linked to?
With this level of spread and the number of cases that we're getting, it's I guess it's everywhere. So we're getting outbreaks from workplaces. We are getting some outbreaks from schools. And in some cases, people don't know where the exposure occurred. So it does make it difficult. We don't have any very large outbreaks at this point. And also I do want to point out, because in previous surges, we did have large outbreaks in the long-term care facilities. Although we do have some outbreaks in long-term care facilities now, they're not at the size that we had in previous surges. And we believe that this is because of the high vaccination rates in these long-term care facilities for the residents.
Brandy, go ahead.
Thank you. Would Sacramento County Public Health consider a temporary health order that allows teens to get vaccinated without parental consent, as some other cities and counties have done in California?
We have been able to work with the system that we have right now, where we do get the consent signed by the parents. So we are not considering any additional orders.
Alex?
Yeah, I have two questions. The first one I'd like to ask is, Sacramento City Mayor has, Darrell Steinberg has indicated he's interested in a vaccine mandate for certain indoor activities. I wanted to ask, has the city contacted the county at all in consultation about this mandate? And once again, I'd just like to clarify, based on I guess 2 weeks ago, you had said that you're not considering something similar for the county. Is that still the case?
We are not considering it for the county. And yes, the city has been talking with us as they're considering their options for how they're going to roll this out.
Can I ask why the county why the county has decided not to move forward with a similar mandate that other localities have? And is there anything, is there a threshold that the county would meet that would make you guys consider implementing something like that?
At this point, it was more looking at the resources and being able to provide the enforcement. And so we are providing support for those businesses that are choosing to do so, especially for events, and also supporting the sectors that have to do the mandated testing because they're either healthcare or congregate settings.
Thank you. And I just have one last question, just to go back to the conversation we were having earlier on that September 20th start date for booster shots for all adults. I was wondering if you could walk us through the county's preparations for seeing that increase in vaccine allocation over the fall and eventually the winter time, given that I know a lot of the county vaccination sites were vaccinating early on healthcare workers and then eventually teachers and the broader public. What's sort of the preparation there happening right now?
Rachel, do you want to take that one?
Yeah, you know, we just got this news, so I would just say stay tuned. We will work closely with our health system partners. We're going to have to take a hard look at how we vaccinate it's going to be a significant number of people. Especially when we look back at the dates where we did a lot of vaccinations on a day, you count down 8 months, and I think people are going to be eager to get that third dose. So I think it's a little early for us to share plans, but we'll be able to share something with you in the future.
Thank you.
There are no additional questions, so that will conclude today's public health COVID media briefing. As always, I will send out a link to our media distribution list to download the video, and it will also be linked on our website. Thank you very much.